Welcome back for our next panel discussion on sustainability. NHS estates and accompanying facilities account for 15% of total carbon emissions, including primary care, trust estates and private finance projects. The Public Sector Decarbonisation Scheme is currently in its third phase and has seen NHS trusts across the UK unlock large amounts of funding to invest in their estates to make them more sustainable. Most of this funding so far has been spent on heat pumps, double glazing, insulation, energy management systems, draught proofing, solar panels, pipework insulation, and LED lighting. And in this panel, we'll hear from sustainability teams across the NHS to get a sense of the progress they're making towards net zero and help navigate a space with a vast choice of possible improvements in sustainability. So, with me to discuss this topic, I'd like to welcome Alex Pitman, Green Project Director at Alder NHE Trust. We have with us Angela Hayes, Clinical Nurse Specialist, Specialist Palliative and Supportive Care, the Christie NHS Foundation Trust. We'll have Janet Smith, Head of Sustainability for Royal Wolverhampton NHS Trust. And last but certainly not least, Cameron Hawkins, Head of Energy and Environment NHS Property Services. Don't forget, of course, to join in with the conversation by using our Q&A function, and please do share your thoughts on Twitter with the hashtag NHE365. When I put my glasses on, it's always nice that I can actually see the screen and see if we have a full house, and we do have a full house. I wasn't sure, Janet, whether you'd be there, but you are, so that's fantastic. Let's start off if I may, with you, Angela. The NHS declared a climate change a health emergency. Do you think that's how staff are responding and acting?
I would have to say no, not as a whole body of staff. I think there are pockets of staff around the NHS that are doing an awful lot of work on this. But I think if you were to ask the average person working in the clinical areas, I don't think they're even aware about the net zero targets, about the climate emergency. I think if you were to chat to the average nurse or doctor in the clinical area, they would probably think about the environment with regards to recycling or waste in the NHS. But as far as it being embedded in part of our job descriptions, our everyday working lives, I would say no.
And Alex, rather, are you experiencing the same at Alder, you know, as Angela is?
Yes, absolutely. It's not part of everyday conversations for most people. We've got a core of fantastically enthusiastic people who are really committed to this in work and outside, but it's not an everyday part of the mindset. And if we did unprompted, what are the priorities of the NHS, we would have to go quite a long way down before we got to this.
And presuming, Janet, that you might be experiencing the same at Wolverhampton, how can we get staff more engaged? Because surely there needs to be that realisation from staff too, to achieve the sustainability goals that you're all trying to achieve.
Yeah. In Wolverhampton, basically, like Alex and Angela, we're also experiencing that. And one of the biggest challenge, of course, is winning hearts and minds. So basically getting staff engaged. What we've been doing is that we're doing quite intensive communication campaign. So including all our trust bulletins and things like that. And we produce videos as well on different campaigns. And I host a monthly sustainability lunch hour where it is actually open to everyone. It's a drop-in session. We have topics on different aspects of sustainability. So like the latest one was all about doing glove in or glove off. So the impact of wearing gloves in the NHS and also in the environment. And of course, it will hit our budget next year when it's no longer free from the national government. The other thing is that we look at the impact of climate change because, of course, during the summer, it was very, very hot. And that was quite a topical aspect. So every time we have a sustainability lunch hour, then the attendees do actually suggest topics that will be, discussed the next time. So we've had walking aids, we've had recycling, which is always something to start. You know, people would say that, oh God, all they think about is recycling, but it is actually an opportunity, because when they ask about recycling, that's your entry into getting into better discussion, more in-depth discussion about other things that can be done or that can be addressed. And like things like, you know, patient bags, people don't actually think about it, but a little bag like that carries 1.58 kilos of CO2. And then we give out hundreds of this to patients when they actually attend their either it's an outpatient appointment or inpatient. We do give them out without thinking about the impact.
Oh, those small things make a big difference. I was on a flight the other day and they gave out to 150 people a tiny miniature plastic bottle of water, which had about 3 mouthfuls in. And all I could think of sustainability wise, how ridiculous that was. Cameron, I feel like we've had a lot of conversation without you involved there. Just tell me, to start with, what steps the NHSPS is taking to reach net zero, and what progress you've made so far with the states.
It's really interesting to hear what the other panelists have been saying and the challenges they've had around it. And we're quite lucky in some regards. We don't have those challenges and the demands on the clinical side of businesses, and you know, for the pressures that doctors and nurses and other medical professionals have. We're very much focused on trying to keep the asset, the infrastructure, the building sort of working. So we probably have a greater influence in terms of, you know, how those assets work. And over the last few years, we've been running a number of programs centrally, whether that's been you know, installing LEDs or increasing you know, what BMS and controls that we have across the organisation. But we're seeing a real shift change after 3 years of, you know, some sort of massive savings of, you know, we've reduced our carbon footprint by 30%. We've saved the NHS over £35 million in the last couple of years.
Wow.
But what we're finding now is that it's the individuals on site going, wow, this is great, but what can I do as an individual? What does this mean in my role? Whether it's a domestic that's going around and cleaning our sites, whether it's an engineer going through maintaining our sites, whether it's a property manager engaging with our occupiers. It's that people are wanting that finer detail now. It's no longer you know, just sufficient for us to do those big central programs that somebody else goes, oh, that's somebody else's problem. That's that central team's problem. We're finding that while we've made good progress, we need to try and actually change that whole ethos of our organisation to actually make it, you know, everybody's role and kind of give them that opportunity to do it. And you mentioned the Public Sector Decarbonisation Scheme at the start. You know, a fascinating program, very hard to get funding out of, can be quite cost prohibitive in terms of actually putting an application together. So we looked at that and we've actually designed our own. We've come up with what we call a regional energy and environment fund. So we work with our construction teams and that are looking at backlog maintenance and forward maintenance and how we kind of build or repair new hospitals for you know, part of customer schemes, and saying, oh, if you're doing replacing a roof, what more insulation can we put on? Are you doing something with controls? Can we you know, increase the level of controls? Are you doing something with the heating? Is this an opportunity to actually decarbonise the site and remove whatever might be using gas on site, whether that's a boiler or hot water cylinders, etc. So trying to find all those little trigger points throughout the organisation that we can go through, and instead of trying to do that big central project and do that separate to everybody, engage everybody and find those small wins. And we're finding that is actually we can do a lot more in a lot more cost-effective manner.
I think in a big organisation like the NHS, Angela, you know, the small differences really do add up. I mean, I'm thinking here, this is my apartment in Shepherd's Bush, and I'm the big bad wolf in terms of, you know, I'm always turning lights off and trying to save energy. You know, with kids, it's like Blackpool Illuminations. But how do we get staff engaged to turn off lights, computers, aircon, when they don't actually foot the bill?
Absolutely. Yeah, these are all the things that I've said. I do lots of speaking about this in my hospital and also outside. I've kind of done more and more national presentations, and these are the kinds of things that I say, that if people are concerned about the environment or their energy bills, they'll turn lights off and computers at home, but they don't do it when they're at work. In fact, they're not footing the bill, so it's not really their problem. And it's trying to kind of continue with those wishes and those, striving to those targets that we need to get through. And I do it all the time. As I walk in, there's always a toilet, a patient toilet. The lights are left on every part of my journey into work. I'll turn this light off. I've even done it to I do it on patient, in ward areas. There'll be showers or toilet lights left on in ward areas. And I've even plunged a patient into darkness when they've been set up through, much to the hilarity of the rest of the patients in the bay watching this. I see everything through my sustainability goggles and I can't quite remove them. But I think what we've done in our trust is that we've implemented the Carbon Literacy Project, which is about trying to teach staff about I think getting through to healthcare professionals, we need to come at it through a different angle. So we can be looking at health inequalities, because climate change affects the most vulnerable members of society. So it affects vulnerable, they're least resilient to the effects of it. So it's about trying to say, this is the health message, this is why it's important. So I've started to think wider than my organisation, and I've been doing it this morning, contacted the RCN, the Nurses Union, to say this needs to be part of nurses' roles. So I've raised it as a matter for discussion at the Nurses Union to say, can we have this as part of our job descriptions, as part of quality markers, as part of curriculum changes in nursing and medical professions? And I think there are definitely things that we can do to make our practice greener, to save money, to save carbon, but also bring about patient benefits. And an example that we're introducing in our team is a light source machine that protects the linings of the mouth and the mucosal linings. When a patient has cancer treatment, this is very much affected and it breaks down. And this light source treatment prevents that breakdown, so patients don't need admission to hospital for feeding, for complex pain management. They don't need antibiotics. It saves bed days. It's miles better for the patients, and it saves thousands of pounds every year. And so it's projects like this that we need to be embedding into organisations and thinking beyond just the buildings. And it's about healthcare models as well as the resources that we have to actually deliver, the hospital buildings itself. And it's wider than that. And I think going in through the health message will help to engage clinical staff.
I think you're right there. I mean, Alex, you're a consultant and you're heading up the Green Plan, which I gather is aimed at saving more than £1 million for the Trust with no capital expenditure and helping define your next steps towards net zero. Tell us a bit about the Green Plan and how you're planning to achieve.
So building what Angela's saying, there's some quite complicated things we need to get across net zero and how it joins up with health. And we need to do that. But the good thing about the energy prices going crazy is everyone is facing into that at home as well. So of topics to engage people with around the Trust, energy prices is quite an easy way to, it's a sort of starter drug for getting into green things for lots of people. So from sort of top of the Trust downwards, we managed to get quite a big focus on energy costs. And lots of it's just real basics of energy management, is using some of the data in a smarter way, getting the buildings to work properly, to be the right temperatures, and to get all the bits of kit working as they're designed to do. And hospitals are pretty complicated buildings, so it's not surprising that there's lots of fine tuning to be done. But we're up to about £1.5 million of saving now. We haven't spent any capital. So there's some quite good fine tuning to do. And the good side is lots of bits of our hospital were slightly odd temperatures, and you could wander around and see some people in t-shirts, some people with hoodies, and some people with hoodies and a jacket on top. and just sorting some of those things out and making people more comfortable. We haven't got it all sorted yet, so there's even more opportunities. But I think it's some of those really basic things, and we've got to focus on this incredibly broad agenda. There are some good opportunities on the basics of getting energy efficiency, and it's a real tangible pound notes thing which we can use to fund all the other stuff we need to do as well.
It's fantastic. Janet, give us a flavour of what, how targets are being translated into actions in your trust. Perhaps some examples of what you're doing that's made a big difference. Because I think it is important to share things like Alex was just sharing his experiences there. We can all learn from each other with this, can't we?
Yes, definitely. With regards to implementing the targets and actions of the Green Plan, on our estate side of things, we are implementing what we call energy savings through turn the lights off and turn your computers off from the wall. That's one thing, and it's fairly successful. But one thing I found is that there are actually computers that you cannot physically turn off. You can restart it, but you can't turn it off. So that sort of put a bit of a spanner on that plan. But we're looking at that, of course. And then the other thing is the trust is actually building a solar farm, which a 30-acre solar farm, which is going to provide us 3/4 of our energy requirement.
Wow.
For 3/4 of the year. So that will actually help a lot. The other thing as well is that, of course, we've moved our supplies now for our energy to 100% renewables, and we are also going into where part of the things that we do is that we have, of course, preventative maintenance and also reactive maintenance. One of the things that one of our group in Canuck Hospital, our maintenance team has decided as part of their initiative, sustainability initiative, is that they're going to use part of the money that they get from new works. When staff ask for cork boards to be put in the wall, they get paid for it. That they're gonna use it actually, and in the rescheduled maintenance monies that they have, to actually change the light fittings on the public accessible areas, corridors, stairs, etc. Use that money, and they were so successful. They've actually managed to change like the whole 3rd floor, half of the 2nd floor, and all the stairs by using just that money. And like in the 3rd floor, you got 60 lights, yeah, at 50 watts. Now they've changed it to 40 lights with 15 watts. So these are things that, they thought they could do rather than waiting for capital funding. This is something that they could do by just looking at their business as usual. And that's what the trust is trying to do. We're looking at our business as usual, how we can make it better and make it more green. So we started implementing our green plan basically back in July 2021, and as of June 2022, we've managed to actually save 9% of our 9% reduction out of the 63,000 tons of CO2. So by just doing business as usual without any capital input, the PSDS monies that we've won and also the solar farm has not contributed to that yet.
That's fantastic to hear, Janet. Really, really good to hear. Just moving on to Cameron, I was going to ask you, Cameron, about where the NHS estate could make its biggest gains, but it also kind of fits in with what Lena's asking. Lena says, what's the biggest challenge or barrier the NHS faces in its decarbonisation journey? What would be the biggest help in terms of installing more solar panels, heat pumps, etc.?
No, it's an interesting one, and actually just to quickly continue on from what some of the others were saying, is we're actually finding, and this is not just within the NHS, is if you have more than 4 people occupying a space, then no one takes ownership of it.
That's interesting.
So they always assume that somebody else has done that action, left that light on, left the heating on, or opened a window for some reason. And what we find through engagement programs is that you might put a poster up, you might put a sticker up, but that traction only lasts anywhere between 3 to 6 months. So you need to refresh that and get that, because otherwise people almost become blind to it. They see, oh, well, there's a light switch. They ignore the switch off sign. So we attempt to automate those functions. So whether it's presence detection or ambience detection, so you might have to walk into a space, turn a light on, physically turn a switch on to turn the lights on. But if you were to leave the space, then that would turn off behind you on that side of things. So we've had great success in terms of doing that. For us, in terms of it's the funding at the moment, I think is the biggest challenge in terms of it, and the nature of how that funding's being released. Spent well over 20 years in this industry, and my accent gives me away. I'm not originally from this country.
Are you not?
No. But it's a lot of my first start of my career was back in New Zealand, and we don't have a gas infrastructure, so there's been an awful lot of heat pumps installed on those sorts of aspects. So it's a proven technology. It's one that's been used across the world, mainly for air conditioning, but now you can flip that around to be a heat pump as well. So what it is for us is that how do we change and influence all those trigger points throughout our organisation? So whether that is a customer coming to us saying we would like a wing refurbished, we'd like a new health centre built, how do we influence that design at the building, and how do we get confirmation that funding can be allowed to do that, potentially uplift funding for it, right through to when we're doing the reactive maintenance that Janet was saying, in terms of making sure that we've got correct supplier agreements in place so that we get really good warranties and really good for both labour and install and the actual infrastructure. So it's for us, it's two parts. It's making sure the funding's there right at the very beginning so that we can actually design those buildings and those projects in the most efficient way possible. But it's also making sure that people are aware what influence they can have throughout that process. So we might get it right at the design, so making sure that when it gets designed, that it's not actually being valued engineered out at some point in terms of it, because we can see that there might be some upfront costs, but for us, we'll install it, we'll maintain it, we'll run it, and then we're going to replace it at the end of life. So for us, it's very much what that full life cycle cost is, in changing how do we actually bring that initial capital cost and bring that actual ongoing running cost and end of life cost into it as well. So we get a full cost to the NHS, and making sure that we're making those informed decisions at the start is the real key for us.
Fantastic. Angela, what's your experience, and perhaps the other panellists as well, clinical engagement in net zero? And I know we're sitting here with Alex with his consultant hat on, but what's your experience in terms of clinical engagement?
I think there's definitely interest out there. I think most people in the clinical environment will see the plastic waste, the PPE waste, as the main problem that needs tackling, and I think the conflict really comes in as far as clinical staff having other priorities, that it's almost like the sustainability stuff is something that they'll do if they have time, and the other things in the clinical area seem to trump the environmental stuff. But I've just tried lots of different ways to try and engage people. And I know I kind of hold my hand up. I'm probably very annoying because I never can take these. I never turn the sustainability mode off. It's always there, by, ready to go, if you pardon the pun. But I do all sorts of things. So most recent thing is I've started to do my own. So I've been asked to do podcasts, and then somebody said, you need to do your own. So I'm starting to kind of build up a network of people that I'll do podcasts for. So I was trying just with this drip feed and getting through to clinical staff. So
well, you sound like you're making a lot of good efforts. But and Alex, I do know from hosting a lot of these NHE events that clinical staff, certainly from these events, I've seen often very heavily engaged, aren't they, in sustainability? I remember we've had panels of 4 or 5 anaesthetists, that's very difficult to say for me, anaesthetists, talking about anaesthetic gases and the contribution, you know, that they're making, looking for alternatives. So do you find in your world that clinical staff are pretty well engaged?
Yeah, so just to be clear, I'm not a medical consultant.
Oh, I thought you were medical.
I'm a carbon. No,
you tell me. I was going to ask you to look at my rash, but I
was actually going to use anaesthetists as an example because in our trust, and I think in most, they're one of the leaders of driving change, and I think the difference for them, and this is what we need to do for other specialities, is they've got something quite measurable which they're professionally connected about and talk about as a profession, and we've got ways of feeding back to them how what progress they're making, so they can make tangible change, see the wins, and we can see big improvements. I think we need to find ways of doing that for other specialities around the hospital, because anaesthetists, if we could copy what anaesthetists have done for other clinical things, we'd be making great progress.
Yeah, it's fantastic. I think there's an organisation called GASP, which is all about, you know, greener gases, and it's a fascinating topic. They've been very, very on that, because it's
absolutely
how much the anaesthetic gases contribute to climate change. But also, Alex, I know you've worked in. I'm disappointed you're not a doctor. Not really. You've worked in other sectors. How does the NHS compare? How's the NHS doing next to other sectors that you've worked in?
So I think compared with lots of sectors, it's so distributed that we've got centres of excellence, but we don't really recognise where they are. And I think there's a big opportunity to make the best even better, but there's a long tail of lower performance, which is a real opportunity. And I think in other industries, you've got better benchmarking and clearer comparisons, and those organisations at the back can see the opportunity. I think there's a big opportunity for the NHS to help some of the lower performers get up to what would be fairly average in other industries.
Cameron, just a quick thought on what innovations that you're most excited about.
Well, I'm actually sort of also the business sponsor for our Smarter Buildings program here, and for me, I think it's following on from what Alex was saying before in terms of how do we use data and how do we collect that data to really sort of drive change. We've been doing a similar sort of engagement program in terms of using sort of heat maps and other bits of data to try and work out where energy is being used. But I think the role that the Internet of Things, how we can move to condition-based maintenance, all these sorts of aspects to really kind of fine-tune our buildings to reduce that energy consumption to begin with, but then also allow us to kind of whatever sort of decarbonisation solution will be, it reduces also the amount of capital and infrastructure we need to put into that. So yeah, I'm really looking forward to seeing how we can use more data, big data, to be able to really drive that change and find the most cost-effective locations to implement to our sort of limited resources that we might have.
Janet, I'll give you the final word. What are you hoping to achieve in the next year? What are your goals for 2023?
Yeah, well, I'm hoping to achieve actually more reduction and also more of our clinical teams engaging in greening their services.
Fantastic. I knew that panel would fly by. That half hour's gone by really, really quickly. Thank you very much. That was another fantastic conversation. And thank you, of course, to the panelists who joined me on our virtual stage. And thank you to you, our audience, for also providing some insightful questions. It's time now for a 25-minute break. So please do take this opportunity to network with your fellow participants. And I'll see you at 11:35 for the final part before lunch. Enjoy your break.